Hello, my name is Caitlin Beard, and I'm going to show you how to do proper hand hygiene. Proper hand hygiene, you should either wash your hands with soap or water or use hand sanitizer. You should do proper hand hygiene when before and after patient care, when you have bodily fluids you're come in contact with or open wounds you've come in contact with, and also when you've come in contact with contaminated areas. You should also do it when you have taken your gloves off, before you eat, and after you use the restroom. When you should use soap and water is when you've been exposure or contact to anthrax, C. diff, or infectious diarrhea, and before you eat or after you use the restroom. The supplies you're going to need is soap and water and 2 dry paper towels. So let's get started on washing your hands. You should get it lukewarm water. Lukewarm. When it's too hot, it can dry out your hands, and that can cause cracks. So you get your hands wet from the wrist down, and then you use about 1 teaspoon of soap, and then we're going to start a lather in circular motions. You should also wash your hands below your elbows, have it below your elbows. So you're doing a lather, circular motions, and then you start on the back of your hands in circular motions when you start scrubbing. And then you get your thumb. And this should all take about 20 seconds in real time. And then you do each individual finger. And then also, if you have jewelry on, you really shouldn't have jewelry anyway, because it can spread germs in your jewelry, when you wear your jewelry to your hands. So if you have a wedding ring on or a wedding band, sometimes that's okay. Just make sure to keep your wedding band on and clean it when you're washing your hands. So after you're finished washing your fingers, then you're going to start getting the knuckles, all the crevices in your knuckles. And then you're going to do each fingernail. You have to get all the dirt under your fingernail. Also make sure to get in the crevices in between your fingers. The dirt and germs can get trapped anywhere. Also make sure to get your wrists about 1 inch above your wrist. And so when you're done scrubbing, then you get the water and you go to your wrist and down below. And make sure to keep your arms down below your hands down below your elbows. Now you can't see it while I'm here, but. And then before you don't turn off the faucet yet, you get a dry paper towel and you just pat your hands, and don't scrub it, because then that can aggravate your hands more, and it can cause more cracks. So you just pat. And you discard this paper towel. You get another paper towel, and you turn off the faucet with that paper towel, and then you discard that as well. The reason why you want to use dry paper towels is, and not use wet paper towels in general, because if you don't turn off the faucet with using wet paper towels, you can transfer germs that are on the faucet, and it will transfer to the wet paper towel to your hands. And so you don't want to use wet paper towels. You want to use all dry paper towels and stuff that you can discard. Don't use any rags or anything. So that is how you professionally wash your hands.